Hello all, I am Carly Fryer and this is our Group 7 presentation about addiction. So my group mates and I will be discussing all of the different aspects that come along with addiction.
My name is Julia, and to begin, I would like to go over what an addiction is. So, an addiction is a disease manifested in the brain where someone compulsively seeks a substance, disregarding harmful consequences. You can think of this as a rewiring of the brain systems involving reward, memory, and motivation. Some commonly abused substances during an addiction are alcohol, cocaine, or hallucinogens, but you can find a longer list of this within our study guide. I would like to go over some common misconceptions people have about addiction. The first is that it's easy to stop at any time. This is not true, as with an addiction, your brain becomes dependent on a substance, so therefore it makes it harder to stop and it takes time. The next is that alcohol and prescription drugs are not as bad as illegal drugs, so therefore don't lead to as bad of addictions. This also isn't true, as the abuse of any substance can cause harm to the mind and body. The next is that addicts are generally homeless or criminals. This is also not true, as addiction does not discriminate. You can be extremely successful, have a large home, a large family, and still be addicted to a substance. The last thing on this slide that I would like to talk about are just some impacts that addiction have on the United States. The first is that almost 21 million Americans have one or more addictions, but only 10% of them receive treatment. The next is that 20% of Americans who have depression or anxiety disorder also have a substance use disorder. And the last is that addictive drugs are generally used within the ages of 18 and 25.
Hello all, I am Carly Fryer and I'm going to be discussing relevant drugs in American society. This is kind of a shameless plug for BIO444C and Soc 301. So we're going to first be discussing drug use in sports. Performance-enhancing drugs and mood leveling, they act to level the moods and reduce extremes of emotional states and enhance physical performance. Examples include antidepressants, lithium, anabolic steroids, and human growth hormones. Stimulants speed up central nervous system activity. Examples include crack, cocaine, amphetamines, caffeine, and nicotine. Depressants slow down central nervous system activity. Examples include alcohol, barbiturates, tranquilizers, sedatives, inhalants, such as gasoline or paint fumes, toluene and glue, and ether. Narcotic examples include opium, morphine, codeine, heroin, methadone, hydromorphone, and oxycodone, or by name brand Oxycontin, Percocet, and Percodan. Narcotics are generally depressants and also have an analgesic and soporific effect. These are all derived from the poppy plant or are chemically very similar. So most famously, DARE is the well-renowned field drug prevention program. These are all different education models to help prevent the harm to society of drug use. So there is the harm reduction model, which is like the needle exchange program. This is incorporated into societies to help prevent the spread or lessen the spread of HIV and AIDS. So vans would go to hotspot areas like parks or group homes, just where there is high use of drugs, to deliver clean needles for addicts to use. I am not 100% sure if it is like needle for needle, like they bring their dirty needles. I can't exactly remember, but the success varies across different education models. So social influence programs, which was DARE, famously unsuccessful. Effective programs, which is unclear about their effectiveness. Information models, which are most familiar to baby boomers, these have yielded disappointing results. So, as it seems today, the most effective model to prevent drug use is the harm reduction model. Fun facts for you. So, smoking on campus is strongly associated with alcohol consumption. Although prevention programs typically focus on these as isolated behaviors. And a study in 1999 surveyed students at 119 colleges across the U.S. and found that 52.4% of student athletes reported current binge drinking. This is compared to 42.6% of non-athletes.
Hello, my name is Travis, and today I'm going to be talking about the pathophysiology of an addicted brain. The physiology of a normal brain and the pathophysiology of an addicted brain are markedly similar. The main difference being an addicted brain takes the normal functions of the brain and causes them to work together in a manner that is abnormal. So the three regions of the brain that are implicated in an addicted state are the basal ganglia, the extended amygdala, and the prefrontal cortex, whose functions are reward and habits, fight or flight, and executive function, respectively. In addiction, the central neurotransmitter that's used is dopamine, and it results in a reward experience for the body. The three regions of the brain that are affected correlate perfectly with the three stages of addiction, which are binge, withdrawal, and anticipation. So the first stage, binge, involves the basal ganglia, which two areas stand out in addiction. You have the nucleus accumbens and the dorsal striatum. The nucleus accumbens is involved in reward, where dopamine is dumped into it, and it encodes for your body that this is something that you would like, through the dorsal striatum, which tries to make a habit out of this. Essentially, your body realizes that this feels good and thinks it's a better state than it's currently in, so it wants to achieve it again because your body's constantly looking for what it perceives to be homeostasis, which is the best state you can exist in at the moment. Then, in withdrawal, after your body has experienced a high level of the drug, depends on which drug you're using for how much you need, you are less sensitive to any given neurotransmitter. So when you lose the drug, your body requires a lot to achieve its state that it wants, and this leaves you deficient in some manner. Your body interprets this as bad, and the amygdala, doing what it's supposed to do, sends out signals that your body is in a bad state and should try to get away from it. And this results in the classic withdrawal symptoms that make you miserable, aside from physical symptoms that come from the actual loss of drug. Moving on, you have the anticipation stage, which is where you're looking for the drug. The prefrontal cortex is the area of the brain used here. And the prefrontal cortex is your executive function side of the brain, so it's your conscious mind where you make decisions. You can split the prefrontal cortex essentially into two areas. You have the go area and the stop area. The go area is activated in these addicted states, which makes you perceive that the drug is a goal that you want to go get. And so you can consciously know the drug is not something you want, but your brain is telling your prefrontal cortex this is something that you should be looking for. And so it creates this cognitive dissonance, which is very uncomfortable for people trying to get off of the drug. The second area, the stop area of the prefrontal cortex, is turned off by the activation of the amygdala, because your body says we're miserable, so let's stop telling the prefrontal cortex to stop doing something and tell it to go do something else. Essentially, it doesn't want the prefrontal cortex shut down. It wants you making decisions that result in you getting away from your current state. This is problematic because now you can't turn off your dorsal striatum. The prefrontal cortex, when you tell yourself to not do something, goes to the habit area of your brain and says, let's not do that again. But with the stop area turned off, when you actively are saying, I don't want to do this, your brain subconsciously is not following through with that. So once again, the cognitive dissonance is apparent, and it's overwhelming because you are unable to lower it on some level. This is what makes it so hard to get off of an addiction, especially for people who have weaker stop areas of their prefrontal cortex to begin with. And that is why you see variance in people with their sensitivity to addiction, because they are more sensitive to dopamine, or they have less control over their habits from the stop area. And you see neurophysiological differences among people, not even related to the drug, that result in having different amounts of addictive needs.
Once again, it's me, Julia, and I will be going over prognosis, so the likely course an addiction will take. An addiction can cause harm to many organs and organ systems of the human body, and this damage can be long-lasting if not permanent. The effects of addiction can also differ between an individual and depend on the substance being used. Here are just a few examples of the effects addiction can have on the body. In the cardiovascular system, stimulant abuse can lead to long-term heart diseases. For example, cocaine can cause heart failure, heroin can cause a collapsed vein or infection through sharing needles and lead to diseases like HIV, and alcohol can cause a stroke or heart attack. Within the respiratory system, you can experience lung damage or shortness of breath from drugs that are smoked. Many organs like the liver can also be affected by addiction over time, and you could read more about the effects addiction have on the body within our study guide. As for the effects addiction have on the brain, stimulants release the neurotransmitter dopamine in large amounts and overstimulate the brain. This overstimulation causes a sense of reward and pleasure, making an individual seek more of a substance or turn to harder drugs. This also makes it hard for the brain to adapt without a substance, and you can read more about the effects addiction has on the brain within our study guide. As I mentioned before, effects of addiction can be long-lasting if not permanent, so the sooner someone seeks treatment or gets help, the better chance they have at minimizing these health effects.
Hey, Hannah here. So, in regards to treatment for drug addiction, it is not at all a simple process. Most patients need long-term repeated care to stop using drugs completely and recover their lives. Addiction is much more common than one might think. In 2016, about 21 million people in America aged 12 and older needed substance abuse treatment. So that's a very scary statistic that needs to be addressed and discussed more often. No single treatment is right for everyone because of how differently the brain responds to drugs depending on each unique case and individual. People need to have quick access to treatment, and effective drug treatment addresses all of the patient's needs, not just their drug use. The first step in any sort of treatment is to get the drug out of one's system in a process called medically assisted detoxification. Then, various forms of treatment are available, like therapy, rehab, and drug-related programs. Rehab is usually where people start because it's structured to tailor the needs of each individual and start the detoxification process, along with offering an education and aftercare process to maintain sobriety. Behavioral therapy helps those recovering from addiction to find connections between their thoughts, feelings, and actions, and increase awareness of how these impact recovery. And also, drug related programs like one called the 12 step touch on everything from detoxification to broader types of addiction recovery, whereas biophysical treatment gets the residue of drugs out of one's body through natural, healthy living approaches. So, the goals of treatment are recovery, which helps to stop drug use, stay drug free, and encourage a productive life. Recovery can be achieved by getting follow-up care and rehab, which reduces relapses and recurrences, which will be covered in the next slide. And a life-saving resource is the National Helpline, which is listed here. Having this saved for you or a friend is a great first step to help in addiction cases overall.
Hi, it's Julia again, and in this slide I will be going over relapse and withdrawals. So a relapse is a reoccurrence of the substance abused while already in recovery, and generally addicts go through a relapse once, if not more, during a recovery. So a relapse can be categorized as two things. The first is a slip, which means taking a small amount of an illicit substance and then returning to recovery. And the second is a full relapse, which means looking for the substance abused either for one session or for a binge, and can trigger a return to addiction. There are many triggers to relapse, such as reliving a memory with an addiction or seeing someone use that substance, so it's important to look for signs such as increased irritability, drug cravings, or isolation. Withdrawals are physical and mental symptoms felt after stopping an addiction. You can visualize this by thinking of your brain as a spring. Stimulants press down on sections of the brain, so with an addiction, it's as if the spring is being constantly held down. Once you stop the use of a substance, the spring is released, and that recoil causes the physical and emotional symptoms that are listed below and within the study guide.
Hello all, it's Carly again. So after learning about the background, physiology, treatment, long-term effects, and a little bit of the sociology, there are many ways to make connections with the broader aspects of the science behind addiction and how it can apply to functioning society. Here's a little Q&A, so feel free to pause and reflect or follow along as I go over our collaborative researched answers. What type of factors contribute to addiction? This list is not exclusive. So, genetics, mental illness, home and social environment, stress, and trauma or abuse can be all contributing factors to addiction. It's not exclusive though, so there are more than just these listed factors. 2. So how would the brain metabolism, differ in a healthy brain versus a diseased brain? So drug addicts, their metabolism would decrease. CT scans online show the difference between an addicted brain and a normal brain. So I really suggest going to look these up. The neural pathways are affected as a side effect. So 3, what is the most prevalent addiction? We researched a lot and we found that alcohol was the most present. Population, 31% are alcoholics versus drug addiction at 17%. Next, one criteria for diagnosing addiction. So substance is used for longer or in higher doses. Efforts to quit are unsuccessful. Tolerance develops. But again, this list is not exclusive. So next, some health issues that can come with addiction: lung or heart disease, stroke, cancer, and infections like HIV, hepatitis, or AIDS. These latter are fairly common for the long-term effects list. So 6, can addiction cause mental disorders? If so, what is an example? So yes, it can cause anxiety, depression, schizophrenia. These can all be developed from drug addiction. 7, how do overdoses occur physiologically? I found this in my resource and I'm very excited to talk about it. So in the case of narcotic overdose, theoretically, if one consumes a large enough amount of narcotics in high enough concentrations, the respiratory system can slow down to such an extent that the brain literally suffocates from lack of oxygen. This is due to the sporific effect of narcotics. So it induces tiredness, meaning that the functionality of the body decreases to an extent that the brain will literally suffocate from the lack of oxygen. So knowing the broader scope and making connections between all of the previous slides, there are many ways to get thinking about how drug addiction can affect anyone's life.
Hey, Hannah here. So after discussing all the information and detail that goes into addiction, a recap is very important to solidify that information. So with the question, what is addiction? This is when any drug becomes harmful to the body through dependence being developed on it. And the physiology behind this is dopamine is released, which takes the brain through 3 stages of binge, anticipation, and withdrawal. There's many long-term effects that happen to the organs of the body, like the wear and tear that they experience, which can be long-term or last forever, along with the tolerance that the brain begins to develop. Treatment is so essential in order to recover, and options for this are therapy, rehabs, or drug-related programs. Relapse and withdrawal are much more likely to occur if one does not seek help, and there are triggers along with emotional and physical symptoms that come along with this. One of the most important things is simply having a conversation about addiction by taking college courses, discussing it, just talking to the general public in order to end the stereotypes and misconceptions associated with it that are very damaging to individuals who are struggling. Also, college students are in the range when the most addictive drugs are used, so calling a national helpline or seeking treatment should be normalized. And again, remembering that you are not alone. Understanding how drugs work in the body and knowing resources to go to if you are experiencing a drug addiction will result in a happier and healthier society.
So here are our resources. If you are to take anything away from our presentation, I recommend that you read The Sociology of American Drug Use, even if you do not take Sociology 301. I found it a very interesting read, especially whenever it came to addiction, which is why I chose this project. So I thank you for listening, and I hope you have a great one.